So, this is a topic that I've really become passionate about over the last few years. It started with a good friend of mine who was starting to think about starting a family of her own. And when she went to her sleep doctor, his advice was, since there are no medications that have been proven safe for pregnancy, he recommended that she stop all of her medications. And this was really surprising to me, and made me quite anxious about my own future as somebody living with narcolepsy. And I think the position that women with narcolepsy are left in the absence of really robust research and data on medication safety, symptoms, and symptom trajectory during pregnancy, is they really feel like they're left on their own to make these really difficult decisions about taking medications, what that might look like, and end up sort of relying on anecdotal advice from peers rather than what we, I think, would all prefer, is data. I think, there's two main research gaps. One, as I mentioned, is the sort of like lack of data on medication safety during pregnancy as well as lactation. And I think really sort of advocating for the companies that are developing and have developed drugs for narcolepsy and other hypersomnias to sort of work together to try to participate in registries, either voluntarily or because it's required via the FDA, to start to answer some of these questions and close the gap on, like, is this medication safe or not for use during pregnancy and lactation. I think the other piece is, some people will report their symptoms of narcolepsy improve during pregnancy. Others feel like they don't change much. Others feel like they are much worse. So really understanding, what the trajectory of narcolepsy symptoms is like during pregnancy and what are predictors of people that might actually see improvement in symptoms versus worsening symptoms during pregnancy.